Hi, this is Mrs. Saley bringing you another career spotlight today. Today's career is nursing, and with me I have Jacob Saley, who is a nurse at United Memorial Medical Center in Batavia. He has a bachelor's in nursing from Damon College. So I'll just turn it over to Jacob, and I've just got some questions for you, Jake. So how and why did you choose nursing as a career?
So I chose nursing because I had some friends who were nurses and they seemed to make a good amount of money and they also like their job as well. So um, that kind of inspired me to go to school for it. And then when I was in school, I actually ended up really liking it. So
Awesome. And describe a typical day in your position.
let's see. So I work night shift. So I get there around 6:37 and I look at the patients. Usually, the charge nurse or just whoever's available talks to us and tells us like the situation with all the patients. Um,
Oh, that's right.
and
You're in intensive care, right?
yeah, I'm a medical ICU nurse. So we go over all the patients and then we decide a good assignment for everybody to take, and then we get a report from the off-going nurse, and then it usually starts with looking to see if there's any meds or any labs or anything of it that we have to do. Then we do an assessment, and then it's basically just doing labs, taking vitals, assessing the patients, seeing if there's anything they need, and it basically goes on throughout the night. So I do an assessment every 4 hours. Labs are scattered throughout the night depending on the patient's diagnosis or situation. The meds are also scattered. Um, and then also the patients I deal with are very sick. So if they if they get sicker throughout the night, we have to start different therapies. Or if they start getting better, then we take the therapies that they're having and we kind of bring them down. Um, yeah, titrating medicines like IV drips in the ICU. Certain medicines we can raise or lower depending on the patient's response to them. And so it's just kind of that loop over and over for the whole 12 hours.
Awesome. And, you know, what kind of skills, like what skills do you use? Not, and I'm not talking necessarily nursing skills. I mean, because you learned all your nursing skills in college, but other skills that maybe you use in a nursing career that you could then apply to other jobs.
So you have to be really good with communication. You talk to the doctors a lot and you got to explain the patient situation clearly. Also with your coworkers, if you need help with something um, or or whatever, you need to be able to communicate. Also, with day shift, they talk a lot to case management and things like that are less in the clinical sense of things. So yeah, communication is good there. Being independent is really important. Obviously, there's a lot of stuff going on with every single patient, so there's not always somebody there available to help you. So being an independent thinker and I guess kind of being tough is important. But then also, if somebody's really crashing and you kind of got to rally the troops for helping, and you got to be available. You got to be able to take help, and also leadership is very important. Maybe half the time I work, I do charge nurse, and sometimes depending on like who the supervisor is overnight, even though I only have 2 years experience, I end up being the most critically care trained person on the inpatient side of things in the hospital. Um, and so you kind of got to.
What does it mean to be a charge nurse?
So in the ICU, charge nurse does a lot of like the bookkeeping things, but then we also put patients in certain rooms that we think are most appropriate for the patients. We make assignments. Um, we report to the supervisors if anything happened, and we give them like a short report on our patients. And yeah, we put people on call, or we call them off, or call them in. Um, yeah, a lot of that kind of secretarial stuff, but then also the leadership part as well.
Awesome. Good. And you had said critical thinking is important
Yeah.
before, um, because probably sometimes you kind of have to think about what you learned maybe 5 years ago because you don't use those skills every day, and you got to think about them in an emergency situation.
Right.
Yeah.
Yeah, it's making connections. It's like somebody with respiratory distress. Now, is the respiratory distress associated with pneumonia, or is it more cardiac with like a consequence of heart failure? So you got to kind of think of that, and then your treatment is built from that. And like you tell a doctor, and like if it's cardiac per se, say, oh, they have swollen legs and they're having respiratory distress, therefore we can't give them a nebulizer because that's not going to do anything. We got to give them like something like Lasix, something that'll take the fluid out of their lungs, which is causing the issue. So it's a lot of interconnecting pieces of your assessment and thinking back to like the pathophysiology of things.
That's so cool. So what do you love about nursing?
I love the work schedule, even though it's rough for the 12 hours. I really enjoy only working 3 days a week and having 4 days off. I love the prospects of nursing. You can stay a bedside nurse for a while, or they encourage you to go into management. You can go back to school to be a CRNA or an NP or a midwife. Let's see, what else do I like? The pay is pretty good too, not gonna lie. And then if you want to stay bedside but you want to make a lot more money, there's travel nursing available, and you can make like $2,000 a week. And yeah, so there's just a lot of avenues, and even depending on your personality, there's a lot of different choices you can do. Like if you are kind of a people person, you can do home health. You can work in a nursing home where you get to know people more. If you're kind of like an adrenaline junkie, you can do the critical care, like the ICU and the ER. So yeah, or you can do a desk job working for a health insurance company. So there's a lot of different options.
That's awesome. Okay, so great things about your career. Let's turn the tables and think about some of the disadvantages of your career.
Yeah, so nurse burnout is a very big and real thing. It is a tough job, and you're on your feet and you see the worst of your community. So it can really burn you out. And then like higher ups in hospitals can kind of be money hungry, and it kind of ruins things for you. But I mean,
that's good. That's good that you can only think of those. Yeah. Well, and 12 hours a day, although it's nice because you only work 3 days, those 12 hours, you're pretty much probably shot the following, the fourth day,
Yeah. It's basically, you're essentially working 4 days because the last day is just a recovery day.
Especially on nights, right?
Yeah.
So let's talk about your education a little bit. Where did you train? I kind of mentioned you had a bachelor's degree from Damon, but the program that you were in, what did that look like those 4 years? And what's required and then what's recommended? You already kind of touched on that a little bit about the options to be able to become a nurse practitioner or an NP, that's called, or what's a CRNA stand for?
Certified Registered Nurse Anesthetist.
Okay, and that's working with anesthesia.
Yeah.
Okay, so tell us a little bit about your education.
So I did it differently than most people. I did a 1-2-1 program through Damon. So I go to Damon for a year and then go to a community college of my choice. I chose GCC, and then back to Damon for another year. But for the most people who go into nursing do their associate's degree, and then there's a BSN in 10 thing that within 10 years of you graduating your associates, you have to have your bachelor's. So most people do that because even though it's a tad bit harder to get hired without your bachelor's, it's still there's such a nursing shortage that you'll have no problems getting a job. So people get their associates and then slowly work through the bachelor's curriculum and get their bachelor's. People find that the most financially, I guess, they're able to do that the best, spending the least amount of money and making money while they go to school.
You could do that part-time, right?
You can. Yep. I split up. So I did like a 1+2+1.5. I did part-time for my last 2 semesters, and that was really beneficial because I could work full-time and then also do school. So that was good.
Awesome. And then what
Oh, and
could
training.
Oh, go ahead. Yeah, training.
A lot of it's on the job. Nursing school is very it's like hard. You learn a lot in a matter of 2 years, but still, like depending on what you specialize in, there's so much more you gotta learn, especially like practical things. So I would say like 90% is on the job training and just getting used to seeing things.
Wow, that's a lot. That's a lot of on the job training. I remember when you were in nursing school.
Yeah, I did. So my first job was a med surg job, and that was 3 months of preceptorship, like on and off, or maybe like 2 months, month and a half, something like. But it was pretty short, but it's still a lot. And then my ICU was 3 months, and it was like a packed 3 months. So.
But you're working, you were just a preceptor, means you're kind of working under somebody else?
Yeah, and you got to like complete a booklet. Like whenever you do something, you have to check it off. And
Gotcha.
Yeah.
So what can, like if a current high school student's watching this and is kind of interested in this career field, what could they do right now to kind of maybe get an edge or build some skills?
So doing good in high school is very important because if you don't do good in high school, then you can't get into nursing school because nursing school is pretty competitive. You can do shadowing. It's kind of rarer than you think, and it's harder to do. Like I looked at letting my brother-in-law shadow at my place, and they need like all your immunization stuff. So it's kind of a lot of stuff to work through in order to shadow. But so in nursing, there's this thing called being a per diem employee, and you basically go to the schedule, and if you see any holes, you fill in your name, and that's when you work, and you're not scheduled anything else. So one really good thing that nursing students and pre-nursing students do is they work per diem as an aide, and that way you get to actually see a lot and do a lot and see what nurses do firsthand. So that's good, and it like works around a school schedule.
Mm-hmm. And that would probably help with some of the schooling too, like getting some of that experience. In Akron, we do offer anatomy as a high school class. So that was something you had to take anatomy 1 and anatomy 2 in nursing school.
Mm-hmm.
Yeah. So awesome. Well, I appreciate your time. And
thank you.
That's my son, by the way. So we're going to shake hands now. All right. See you guys.